Vaginal depth can vary among individuals, but the average depth is approximately 3 to 7 inches, 7.6 to 17.8 centimeters. The vagina is a muscular canal that connects the uterus to the external genitalia. Vaginal depth can change throughout a woman's life due to factors such as age, hormonal fluctuations, childbirth, and sexual activity. The vaginal canal has the ability to expand and contract to accommodate different objects or individuals. The vagina is lined with mucous membranes that provide lubrication and facilitate comfortable sexual intercourse. The walls of the vagina are highly elastic, allowing them to stretch during childbirth and accommodate various sexual activities. The interior, the front wall of the vagina is generally shorter than the posterior, the back wall. Vaginal depth is not an indicator of sexual pleasure or satisfaction. The depth of the vagina does not determine a woman's sexual experience or ability to enjoy sexual activity. The length of the vaginal canal does not directly correlate with a woman's height or body size. Vaginal depth can be influenced by genetic factors. The vaginal canal contains rugae, which are ridges or folds that help increase surface area and elasticity. Vaginal depth can vary during different stages of sexual arousal, with the potential to expand when a woman is sexually stimulated. The depth of the vagina is unrelated to a woman's reproductive capabilities or fertility. The vaginal depth is typically deeper in women who have given birth vaginally. Vaginal depth is not a fixed measurement and can vary within an individual due to factors such as arousal, muscle tension, and relaxation. The vaginal depth can be affected by medical conditions, such as pelvic organ prolapse, endometriosis, or vaginal atrophy. The vaginal canal has a self-cleaning mechanism that helps maintain a healthy pH balance and microbial environment. The depth of the vagina does not determine the likelihood of a tampon getting lost inside the body. The vaginal depth does not directly affect the ability to use menstrual cups or other menstrual products. The vaginal canal does not have a dead end. It leads to the cervix, which is the entrance to the uterus. The vaginal canal has a rich blood supply, which contributes to its health and function. The depth of the vagina does not change significantly after menopause unless affected by hormonal changes or medical conditions. The depth of the vagina is not a reflection of a woman's sexual promiscuity or activity level. The depth of the vagina can vary based on the angle of penetration during sexual activity. The depth of the vagina does not directly affect a woman's ability to experience orgasm. The vaginal depth can be influenced by surgical procedures, such as vaginoplasty or vaginal rejuvenation. The vaginal canal contains the G-spot, an erogenous zone that can contribute to sexual pleasure for some women. The depth of the vagina can be measured using specialized medical instruments, but it is not a routine nor necessary procedure. The depth of the vagina can be affected by hormonal contraceptives, which can sometimes cause vaginal atrophy or dryness. The vaginal depth is not related to a woman's virginity or sexual purity. The depth of the vagina is not related to a woman's age, except for potential changes during menopause. The vaginal depth is unrelated to a woman's ability to conceive or carry a pregnancy. The vaginal canal can be naturally lubricated during sexual arousal to facilitate comfortable penetration. The depth of the vagina can vary between individuals of the same age or ethnic background. The vaginal depth is not a determinant of a woman's attractiveness or desirability. The vaginal canal contains natural bacteria and microorganisms that help maintain a healthy environment and prevent infections. The depth of the vagina does not affect a woman's ability to use menstrual hygiene products, such as pads or panty liners. The vaginal depth is a normal and natural variation among women and should not be a source of concern or comparison. Thanks for watching. Don't forget to like, comment, subscribe.